Well, thank you all so much for joining us this morning. My name's Regunberg. I'm a state representative here in Providence. I was very proud to introduce this legislation to increase access to potentially life-saving fentanyl test strips. And like everyone else here today, I am fully committed to doing everything that I can to make this policy goal a reality. Because we don't have a choice. We are in the midst of an epidemic in our state. The overdose crisis has touched all of us here. I think that there are very few families remaining in Rhode Island who haven't felt the pain of this crisis in some way. And so it's our responsibility to act, to explore every potential tool, every public health intervention that we have. That is the focus of this legislation. How can we save lives? How can we protect our neighbors and our young people who we are losing every single day right now? We know that fentanyl is a key driver in our overdose crisis. At least 70% of the overdoses, of the spike in overdoses that we've seen here in Rhode Island since 2014 can be connected to fentanyl. So this is what is ramping up the risk and the danger for our communities. And as Mike said, we know that the community understands this. Community members who are at risk for overdose are concerned about the presence of fentanyl. They would like to know about the presence of fentanyl, and critically, their behavior is impacted by that knowledge. It affects one's willingness to take a substance. It affects one's approach to that substance. That means that this legislation can and will save lives. And so we think it's important to take that act. And by the way, it's going to save those lives in a really cost-effective manner. Fentanyl test strips are about $1 each. That's $1 to potentially save the life of one of our neighbors or young people. That's a really good bargain. I think it's also really important to note that the advocacy for this kind of public health intervention is coming from the folks who are most impacted by this crisis. It's members of our community who are at risk of overdose. It's the outreach and advocacy workers and public health workers and public safety officers who are dealing with this population every day. I think in general, sustainable policy change only happens when people from the community actually have a voice in the decisions that impact them. That's true when it comes to education policy, it's true when it comes to economic development policy, and I think it's true when it comes to public health interventions like this. So I think it's time to take action. I urge my colleagues in the General Assembly to move forward with this legislation, which has bipartisan support. Let's join with the community, let's listen to the folks who are being impacted by this crisis every day, and let's make sure that we're doing everything that we possibly can to protect our young people and protect our neighbors from this epidemic. I'm excited to continue working and fighting alongside each and every one of you to make this a reality.